Hello, my name is Dr. Raja Adnan Ahmed, and I'm a consultant psychiatrist working in UK. And I'm doing a interview series with successful IMGs who are from abroad and are currently working in UK and NHS and have successfully secured training posts in various different subspecialties. So with me this afternoon is Dr. Anoop, who is currently working in A&E, and I'm really glad to have him with us so he can share his experience of getting training in A&E and life as an A&E doctor as well. So Anoop, thank you very much for joining us.
Thank you, Raja. Thanks for giving me this opportunity. It's really a pleasure to be in an interview with you this evening.
Can you tell us a little bit more about your journey so far, and how did you come to UK? I understand you came to UK in 2017.
I came to UK in 2017. I was trained in emergency medicine from Chennai, southern part of India. I finished my MRChem in India, and I came to the accepted postgraduate medical qualifications by the GMC. Came to UK in 2017, worked as an A&E registrar in the east of England. And then I applied for my training posts and got successful and topped my ACCS interview. And I've been working in the Wessex Deanery as an A&E trainee. Currently, I'm an ST2 and due to start my ST3 emergency medicine training in August.
So what is the procedure of applying for A&E? If a junior doctor is thinking about A&E, can you explain to them how can they apply for A&E training and how to go about it?
Yeah. So basically, A&E has got two types of training. One is coupled training, the other one is uncoupled training. So coupled it's run-through training. So you have 6 years of training in A&E. You basically start from ST1 and then finish up in ST6 if you are doing A&E alone. There is also uncoupled one where you say you just apply for ACCS specialty, so ST1, ST2, and ST3. And if you want to continue A&E, you apply for the interview again in ST4. As a junior doctor, you're starting, you start from ST1, you apply through the ACCS emergency medicine route. The first round of applications will be by November, and the second round will be in March or April, depending upon the timelines. The other route of entry is called the DREAM route, which is the defined route of entry into emergency medicine. So basically, this route is for people who have got some experience in A&E or who are coming from other specialties like doing surgical training and then switching to emergency medicine. So this is basically a 5-year training program through the DREAM route. You will be basically starting at ST3 here, and you will fill up the other competencies that is required in the first 2 years of emergency medicine. It's all concealed into 1 year. The other route, as I mentioned, is directly applying through the HST route, that is the higher specialty training route, which you start from ST4, which again, the applications open in November, December. Then the second round, based upon the vacancies, it's by March.
And what does it involve? Once you apply for it, obviously we all know you need to crest forms and you have to have certain degree of experience, postgrad experience to apply for it. But what does the interview itself seem like? Is there MSRA exam or other stuff which you need to do before entering A&E?
A&E interviews doesn't have any written exams. It's basically the interview. So you will have to apply via the oral route, which is common for most of the specialties. As you mentioned, you get your crest form signed. You need to have your basic life support courses like ALS, which will be more beneficial for your interviews. Once you apply, you get longlisted and shortlisted, and they call you for the interview. On the day of the interview, you have 4 stations. One is a portfolio station, which we'll be talking about in a short while. And the next one is a presentation station, where they'll be giving you a random topic and you need to speak on it. They'll be giving you 10 minutes for preparation and 10 minutes for presentation. The next one will be your commitment to specialty. What do you know about emergency medicine? Why emergency medicine? And then based on that, your marks are correlated, and then your ranking will be out, and then you can choose your desired location of training as per your marks. Your person specifications are clearly listed in the websites. So like if you're applying for the next year of specialty training, by October or November, you will have the person specification listed out and you can go through it of what is all required and how can you get high marks in your portfolio. So basically, marks will be given for some additional qualifications, like if you have done a PhD or some any other degrees, like Indian degrees, or they can score an additional mark if you have an additional qualification. You will have marks for your distinction or academic achievements, like a gold medal in your undergrads or postgraduate examinations. You will also have marks of achievements outside your medicine, like I'm a marathon runner, or you have achieved something in sports, or you have done extraordinary activity in charity. Marks are there. There are some marks for your teachings, especially if teaching a medical student, or being an ALS or an ATLS or any life support course instructor. And then the last section will be for your workplace-based assessment forms. Whether they've got any concerns, are you in process of getting all your workplace assessments? Just a sample of what's going on, be it a mini KEX or a CBD or any procedural competencies. And they also look at your MSF multi-source feedback, which is very important to get your feedbacks from your fellow colleagues, your consultants, your other healthcare professionals also. So all these are looked into your portfolio station, and you need to submit evidence for that. So it's better to have a go through of the person's specifications and start working towards it right from day one of your job, and arranging them so that it's easy for the panel to view your evidences is also very important. So collecting your evidences, arranging them in a systematic manner, and presenting them on the day interview is very, very crucial. Next, coming for a presentation station, you'll be given a random topic. So you have 10 minutes to prepare for it. The more schematic representation of the topic will fetch more marks. And then at the end of your presentation, they'll be asking you a few questions which you need to answer. The next station will be your commitment to specialty station, where they'll be asking you about emergency medicine in UK. So what are the other dual specialties that you know of? How are you committed to EM? What have you done so that we know that you have interest in EM? And it's better that people go through the Royal College of Emergency Medicine website about the new programs that they're introducing, the new guidelines, and the local guidelines, local policies, and any new curriculum coming in, and all the updates, which is very important. The final station, you have the clinical station and ethical scenario station. So you'll be given a case scenario, and you'll have to speak about how do you manage the case. And in an ethical scenario station, it'll be about GMC's good practice. You have to go through them, and based on that, they'll be asking some ethical questions. So this is basically for your ST1 interviews. In your ST3 or ST4 or your dream interviews, it'll be a little bit higher standards, where I think you might have a triad station. It depends on your personal specifications, which they keep changing. You might have a triad station where they ask you to try some patients according to their clinical activities and then start presenting. But your portfolio station, your presentation stations remain the same.
Yes, thank you for explaining this. The other thing I want to ask you, which a lot of junior doctors ask, a lot of people are interested in A&E when they first come to UK, but they sometimes get this feedback that the life of a A&E doctor is quite difficult, especially if you have a family, work-life balance could be challenging. From your point of view, how are you finding the specialty so far? And, is there something that you enjoy?
Yeah, I've got interest in A&E, and once you have that interest, it's very easy to strike a balance between your professional life and your family or social life, actually. Yes, A&E rota is a little bit tough, but it is the same as the other junior doctor rota. The only thing is that in A&E, you are on top floor, so you don't have that amount of, say, that I'm going to go to sleep during the night, as I might get some hours of sleep. You will have dedicated breaks for you, but it's an ongoing and a continuous busy shift you might have. It depends on the day that you're working. Your rotas might be challenging, but at the same time, you have the flexibility. You have fixed hours of shifts, and no one asks you to stay once your shift time is over. Once your shift time is over, you hand over the patients, and then you can go home. and you need not worry about the follow-up of that patient because you have referred to a specialty. It's just that initial stabilization of the patient matters in AD. Getting into A&E training is fairly straightforward. If you are committed towards and starts working towards your e-portfolio and other tick boxes, it's easy for you to get into A&E training. It is competitive, but it's achievable.
And once you train in the UK, you know, a lot of people also ask, what are the chances of working abroad? You know, going to other countries, other English-speaking countries. Sometimes people want to go back to their own countries. I suppose having training in A&E would give you an advantage back home as well. Is that fair to say?
Yes, you have an advantage of having trained in UK for 6 years, and you can go back to country and you can start working in departments also. Like for example, in most Asian countries, when you do ED from UK, people manage both ED and ITU. But now it's changing actually. And if you do, you have an option to do a dual specialty. So you can get trained in pre-hospital medicine. You can get trained in ITU, where you can do 50% ITU and 50% of A&E and balance. You also have an opportunity to do a pediatric emergency medicine as a specialty also and set up your own pediatric emergency department in your own country. And if you have a CCT from the United Kingdom, I think it is recognized in Middle East countries. And coming to other English-speaking countries like Australia, you can apply to the specialist pathway, and you will have to work under the supervision of a consultant for a year or so. And then once it's done, then you can start working as an independent consultant if they are satisfied with your working atmosphere and things.
So the opportunities are great. You know, when you, so if a doctor, a junior doctor currently, or even a medical student or a junior doctor currently sitting in their home country thinking about A&E, or they may be working in UK on a non-training job, what should they be doing to sort of improve their portfolio or make it more in line with A&E to sort of get into that specialty?
Yeah. If they're working in back home or working here, the first thing is now the Royal College has been giving access to your e-portfolios in your home country also. So you pay the e-portfolio fees mentioned in the website, and then you can have access to your portfolio. So this portfolio is helpful for you to know how the system works, get ease with getting the form signed. Like for example, what is a mini kicks, understanding what is a DOPS form or what is a CVD forms and things. First, if you're working in UK, first you need to understand the system because most of the IMGs, they start their first job either in ED or in acute medicine. So it's very essential for them to know the system, how it works, because A&E is one specialty where you have contact with most of the specialties in the hospital, be it surgery or ENT or ophthalmology, because you keep referring patients. So you get to know various specialties. So it's best to understand how the NHS works in the United Kingdom. The second thing is start working towards building their e-portfolio right day one. As I mentioned, do some live courses, involve yourself in teaching some medical students or your co-healthcare professionals, or you can do some teaching in your regular study days in the department or the hospital, which helps you boost your e-portfolio. At the same time, I would say knowing the local guidelines or the college guidelines or the national guidelines about treatment, like for example, knowing the BTS guidelines for the treatment of asthma or COPD would be helpful, because if he or she gets the question in the interview, they can present their answers as per the guidelines based, which will give you more marks. The other thing is also involving yourself in audits of in your department. There are lots of opportunities. You have to go and speak to your educational supervisor, your clinical supervisor, and involve yourself in doing an audit. I would suggest to start by doing an audit, but please make sure that you complete the 2 cycles of the audit, which would give you a complete audit rather than just saying, I've done only 1 cycle of an audit. If you are interested in research, also there are lots of opportunities where you can have a chat with your department clinical director or the person in charge of your audit for research purposes and get yourself involved, which again fetch you very important, crucial marks in your interview.
Thank you for sharing your experience and all this good advice. I'm sure a lot of people who are looking at A&E as a specialty will get benefit from this talk. Thank you very much for your time.